¿Qué pasó, mamita? Aquí estoy, mami. Aquí estoy. Ok, ¿ya? ¿Ya hablaste con Dios?
Sí.
Te voy a poner una almohadita para que no te me ruedes. Acá, ¿ok?
Sí.
Es de mañana. Te voy a peinar.
Ah,
Te voy a poner tu cosita aquí en la cabeza. Ejercicio con tus manos. Exercise. Ok, muy bien, mami. Muy bien, mamita. Every person needs to know that they're loved. They need to know someone cares for them. Aquí están tus taquitos. Morning. I think Milo took your tacos.
that's okay.
And I gave him his también. But I can make some more.
Love you.
Love you too.
Bye, Cruz.
Bye. Otra vez. ¿No quieres tu taquito? Oh, mama. Mom's calling. No, I got it. Ahí va. If somebody were to tell me that their loved one was diagnosed with Alzheimer's, I would tell them it's gonna be okay. It is not easy, but you can do it. ¿Lista, mamita? Ahí va, mami. Okay. Another very important thing is it is not their fault. It is not their fault. My dad has it. Not too long ago, my mom, I noticed that she's forgetting a lot, very forgetful. She's totally blind. She's been blind for 4 years. ¿Qué estás comiendo? ¿Sabes qué estás comiendo? I've been taking care of my parents for 15 years. The beginning, they didn't need as much, but gradually they're declining. ¿Estás feliz?
Sí, mi hijita.
Yo también, mami. Contigo.
Gracias, hija.
There is a number of potential mechanisms for this that includes environmental, social factors, but also some genetic susceptibility factors. Diabetes, hypertension, obesity affect all populations, but it appears to affect disproportionately the Hispanic population. Certainly that has a major impact on Alzheimer's disease. There are a number of very interesting genes that have appeared in the Hispanic populations. For example, ApoE4, that is the variant that confers the highest risk for Alzheimer's disease. Cubans are at higher risk than South American or Mexican. Likewise, there is another very interesting gene called SORLA1 that gives more susceptibility in certain Mexican American or Hispanic populations.
I felt like all the experiences I had in my bag were ready to be used. And also I felt a community that was mostly Mexican American, and they really appreciated having a Latina, talking to them in their own language and sharing the stories. And then you have the notion that health access is very hard. It's not normal that we don't have a county hospital. It's not normal the level of isolation for older adults without a community center. Leaving your family is so important to you, and then you're no longer able to see your mother or your father because you cannot cross back and they cannot come. So it's the chronic stress. Migration, I think it's one of the areas in which I would love to go even deeper.
We are from Michoacán, Mexico. As a young man, my dad came into the US to work. When he got paid, he didn't know what to do with the money. He had never had money in his hands. And he started crying. He taught us to work very hard. Picked oranges and grapefruits mainly, oranges and grapefruits. ¿Qué estás haciendo? ¿Estás haciendo tus trabajitos? My dad, he just turned 98 years old. He was diagnosed approximately when he was about 75 years old. He didn't know what was real and what was not. That's when I started bringing my dad home with me. Every night, every day, I would take care of him at his home in the day and bring him home at night. ¿Quieres que te ayude o tú solito? ¿Te ayudo? Es tu tarea. Dale, hazle tú. Hazle tú. But a year ago, things changed. Mommy is 94, so she was starting to get weak. And I noticed that she's forgetting a lot.
No me acuerdo.
A ver, ¿qué es esto? ¿Qué crees que es? Ya se te olvidó.
Sí.
Si no están, no.
¿Qué es, mamita? ¿Qué es lo que te dio Maya? A ver. Tiene cabeza, tiene dos manos, tiene dos pies. ¿Qué es?
A ver, este más grande.
I mean, I knew she was going to need care 24/7.
¿Qué es esto? ¿Qué estás tocando con tu mano aquí? ¿Qué es esto? La pancita.
To me, the safest thing was to keep her with me. So she's been here almost a year.
Alzheimer's disease causes disconnection in the brain, death of certain cells that are called neurons, which are the cells that are in charge of bringing the information of the world to our awareness. There are many causes that we suspect that accelerate this disconnection, but the root cause of why the neurons are dying still is unknown.
Mira, ¿quién es? ¿Quién es? ¿Quién es? Oh, papito. ¿Quién es? Okay.
Many caregivers didn't understand what Alzheimer's was the progression of the disease. And so in my role as a grief therapist, one was to be able to educate them, but also understand the emotional process that comes into play in caring for someone with Alzheimer's disease.
Agárrale la manita, así.
A message that we often hear in the culture is that other people are more of a priority than we are. People say, es mi cruz. This is the cross that I have to carry.
¿Cómo estás, viejito?
No, bien,
Bien.
gracias a Dios.
Qué bueno,
Sí.
qué bueno.
I don't feel like I've gotten any type of support, like an organization or someone coming to talk to us about it, no. Other than medication, there's no consejo, where to go or how to deal with it or what to do or where to look, nothing. A ver, porque
Dame sombrero.
acá en la sala, agárrate de aquí, así. Ah, míralo, aquí está, pues no lo vi. No lo vi. Ups, cuidado con las patas de la silla, está muy larga, ¿verdad?
Sí.
What's not healthy about it is when we don't reach out for that help. When we fail to recognize, I'm tired, I'm stressed, I'm overwhelmed. It's important for especially Latina females to be able to say, I need to value myself also. I have to take care of myself as well.
Ya es temprano, duérmete un ratito,
Sí,
¿ok?
sí.
What does the Rio Grande Valley need to have in place to make sure that our caregivers are emotionally and mentally prepared? You can take care of a person with Alzheimer's for over 20 years. So how are we really preparing our families?
Señor Padre Celestial, gracias te damos, Señor, por este día y por este alimento, Señor. Gracias por tu bendición.
It took many people telling me, you need help, you need help, you need somebody to help you.
En tu gran nombre, Cristo Jesús.
Amen. Thank you. Thank you. Órale pues, sírvete, mijo. Cada quien. It was so hard for me to ask for help because they're my parents.
I'll start.
Vente, Lina. ¿Comiste bien, mami? Salud, mamita. Sí. Yo tengo la corona ya. When we give time to somebody, you're giving a little bit of your life to them. It's a gift. It's that's your life.
Yo tengo un amigo que me ama, me ama.
Yo tengo una